What I wonder now is, how does it present in a clinical setting? Because I think that'll give us some clues as to where perfectionism can really get us into trouble in different ways.
Well, one of the ways that it comes up is with depression, because perfectionism is probably about the number one personality attribute that most predisposes people toward depression. And it is to do with these unrelenting standards. So someone might be really struggling with stresses at work, but it turns out that they're putting extra pressures on themselves. Or someone might be looking to impress others in a certain kind of way and concerned about whether they're getting that positive regard to feel worthwhile or not. There's an intensity about it of people trying to prove themselves in a certain way that might reflect a level of insecurity behind that. And look, I just might mention as well, that sometimes comes up in situations where people have been pushed by family or cultural circumstances. I'd say often our education system pushes hard for that kind of external achievement. And perhaps that's probably one of the reasons why, say with positive education, there's more emphasis on well-being in other ways and looking at promoting character strengths and other aspects of our development rather than just a focus, for example, on academic achievement or sporting achievement. But certainly with many people who are depressed, there's this sense of falling short. And if people have had very harsh or unrelenting standards, and then if people do become depressed and they're falling short further of what they would typically do, that can become even more of a vicious cycle where the person feels that they're falling even further short of what they should, being very self-critical, saying how pathetic their attempts might be, that they're not even performing as well as they used to, and that can become a real vicious cycle. So with many people with depression, part of it is helping recognise these underlying unrelenting standards and for people to make allowance for the challenges that they're facing, including being affected by depression or anxiety that might interfere with their functioning in some ways. But it also comes up in a number of other conditions like, say, social anxiety, and it might be about giving a talk or something like that where the person's concerned about whether the way they express themselves is seen to meet a certain standard. So how people appear to others can be affected by that. When we think of obsessive compulsive disorder, someone trying to order aspects of their life, if you like, in certain ways that can then be a kind of control in terms of how things appear, trying to get one's world in a certain kind of more perfect order, so to speak. Comes up with eating disorders. Maybe if people have an unrealistic ideal about thinness, for example, restricting their food intake, and that's often based on some rigid expectations about how their body should look. And then I'd say also burnout. We see that often with people who are driving themselves very hard, say in their work life, to the cost of other parts of their life and stresses affecting their mind and body because they're pushing so hard with striving for what might be unrealistic or very harsh expectations and standards.